The Federal Medical Center, Abeokuta, and the Neuropsychiatric Hospital, Abeokuta, are two out of the 72 federal health institutions under the oversight supervision of the Senate Committee on Health in Nigeria. The heads of the two health institutions welcomed the Senate committee members with enthusiasm. They quickly proceeded to a session where the committee engaged the management of the two institutions on their 2023 budget performances in relation to appropriation, fund utilization, and project implementation. The chairman of the Senate Committee on Health, Dr. Ipalibo Harry Ibanigo, says the committee is satisfied with the way the management of the two institutions have shown leadership, capacity, and patriotism, noting that the committee will wade in to tackle some of their challenges, which include power, funding, and the issue of insurance coverage for Nigerians.
Without 24 hours light, cannot do a surgery, you can't do radiotherapies, you can't do laboratory tests and all that. So we are going to see how this can be solved. I know that even the Ministry of Health has provided some funding to take care of power in this budget of 2024 in their service-wide road. So this will also help, as well as encouraging them to look at forms of renewable energy, more sustainable forms of energy, which will definitely help to salvage this.
The CMD FMC Abeokuta is enthusiastic about the transformation the institution has experienced since its assumption of office, but not without some pockets of constraints.
Even I'm seeking for all the medical directors and chief medical directors of all the tertiary institutions in the country. The first thing they will tell you is about electricity and outsourced services, as well as overhead. Once those three are solved, sky is the limit for us. We do perform a lot of wonders, and Nigerians will definitely see our impact in the health sector.
It was what FMC is doing that make us to also look inward, and that's why we're able to open up our hospital to reduce the stigma, and that's why we don't have people coming to our hospital for general medical conditions, not necessarily psychiatric issues, and we learned that from Professor Musa.
While taking the committee on a facility tour of the hospital, Professor Olomu happily informed them about the latest achievement recorded, which is the successful acquisition of an oxygen plant for the hospital. In Abeokuta, Lekan Agbonde, NTA News.